Daisy DeRonila, Kearney, New Jersey. Patrick Kane, Flint, Michigan. Ya Asante, New York, New York.
Today we are protesting here in Lafayette Park outside of the White House. Nurses are reading out the names of all of the registered nurses across the country that we know of that have passed away during the COVID-19 outbreak so far.
President Trump, we have a message for you. You have failed to protect our country against the novel coronavirus. You have failed to protect the American people. You have failed to ensure that our healthcare system can meet the needs of this challenge. You have failed to protect doctors, nurses, and all other healthcare workers. In doing so, you force us to risk our lives in order to save our patients. Across the country, nurses are caring for patients without the personal protective equipment that we need.
I myself had COVID-19, and I think it's important to read out these names because these are real people, people in our country that are dying from this, and they just want to be able to do their jobs safely without getting this virus, but that's not possible clearly because we're having many healthcare providers and other people that work in the hospital get sick and die from this.
It's like this pit in your stomach where this could be us. This is one of our friends, this is one of our brothers, this is our sister, our mom, our dad. And something that was preventable easily.
We'll be calling on President Trump and Congress to both pass an OSHA emergency temporary standard to protect healthcare workers, including nurses, and to fully invoke the Defense Production Act so that we can drastically increase the protection of the needed personal protective equipment, which must include respirators. N95s are the minimum respirator we need, and we need billions of them to get through this crisis. Our primary concern is making sure that registered nurses and other healthcare workers are protected, and if states or the country is opening back up for business, but nurses and other healthcare workers and other frontline workers continue to not have the protections they need, we will continue to see our healthcare workforce get ill. We will continue to see nurses die of this virus, and we need to focus first on protecting nurses, healthcare workers, and other frontline workers.